When I was at work, I noticed that I was sitting at my desk and, I was going to the computer and all of a sudden my pinkies just started jumping up out of control and I couldn't stop it.
It's very hard for him, He tries, but when he's off meds, he can't really interact too much with people.
And so I had to, quit my job, because I couldn't perform, at 100% anymore. In the Veterans Hospital, I went in the year 2000, and they diagnosed me with Parkinson's, and they started me on medication.
Well, Parkinson's disease is primarily a deficit of dopamine in the brain.
Dopamine is a chemical messenger in the brain that can affect movement.
Levodopa is what we consider the gold standard drug in the treatment of Parkinson's disease. It has the best effect for the motor symptoms of Parkinson's disease, with the least amount of side effects compared to the other drugs.
So what levodopa does is it actually helps replace the dopamine that's missing in the brain.
We use a simple analogy of either being on or off. When a patient is on, that means they've taken their medications, the medications have kicked in, they're starting to feel the benefit from the medications and they feel some improvement of their Parkinson's symptoms. And when the medication wears out of the system, they start to turn off, meaning that the medications aren't working as well, their Parkinson's symptoms are more prominent.
And, if I don't take my medication, the tremor starts,
And on the other hand, the same thing. Mr. Gomez, in his off state, he has more Parkinson's symptoms, and for him, this involves mainly slowness and tremor. You'll notice that he has more tremor on the left side of his body, particularly in the left arm.
Off state, his tremors are there, his stiffness is there, he's unable to lift his leg and walk normal, his stuttering is there. It's very hard for him.
And then if you don't mind doing it one more time, just turn around and go back to the other side.
When he's on the meds, he's able to function. The tremors subside.
And just go back and forth. Right, it seems a lot better than before.
He's able to walk a little better, he can lift his leg a little better, and he's able to speak clear.
And then the same thing one more time, just go back to the door. In Parkinson's disease, there is a problem with the medications that we find that we can't keep them at a steady level in the bloodstream throughout the course of the disease. Actually, earlier in the disease, it's easy because the brain is able to take up and store the medication that we give them, so we can get away with giving the medications a few times a day, and the dopamine is released at a constant level through the day.
Over time, as the Parkinson's disease progresses, you will find that symptoms wax and wane. Where you were getting benefit for a full 4 or 5 hours from the medication, you're no longer lasting that entire time after you take the levodopa dose. It's because of the fact that the disease itself is progressing.
So our goal in Parkinson's is to keep those levels as constant as possible so that the patients can have continuous symptom relief through the day.
Levodopa itself does not affect the progression of Parkinson's disease. It purely helps to treat the symptoms.
Patients frequently need medication adjustments in Parkinson's disease because this is a progressive disease. As time goes on, the types of medications that people need and the dosing frequency and schedule change frequently. So I usually address this at every visit with patients, and often every 6 months or 12 months we're making a medication change.
It's very important that patients take their meds exactly how they're prescribed. If you skip a dose or miss a dose, the medication's going to wear off, and then you will have your Parkinson's symptoms. As time goes on, it can get harder to get the patient back into that on state where the medication is working if they've come off of the drug and they're having really bad symptoms. It just gets more difficult to control as the disease progresses.
Well, there's several strategies to keep up with medication regimens. One is to have a fairly strict schedule with the medications.
A pill box is really key to sort of keeping yourself organized. It helps take the guesswork out of, did I take my medication? Did I not take my medication? Because you can check inside the box and see that it's gone.
About 6 times a day I take my pills. I take about 30-something pills a day. Not just for Parkinson's, but for other things I have,
Well, Mr. Gomez has a more complicated schedule in that he has to take the medications every few hours.
My wife's the one that knows all my medicine because she's the one that keeps track of them.
There's so many that he doesn't know what is for what. I try to set it up daily or every 2 days.
In the beginning, he could take them every 4 or 5 hours, but we found that his medications became shorter in duration of the effect every time he took them, and so we had to shorten the interval to every 3 hours. This is typical of the more advanced Parkinson's patients where the drugs just don't last as long in the system and you have to give them more frequently. Unfortunately, there are side effects to every medication, despite how good the benefits are. Levodopa has the least amount of side effects typically of all the Parkinson's medications. The ones that I warn people the most about when they're starting the drug are nausea, which is probably the most common, an upset stomach.
It can also cause some other adverse effects like agitation, confusion, dizziness. Those more often happen when you're on a little bit higher of a dose of levodopa. If those types of side effects happen, we usually tell the patient to make sure that they talk to the doctor because there may be some adjustments in the medication that we can make to help reduce those types of symptoms.
Well, there is a complication of the medications that are used to treat Parkinson's disease called dyskinesia. And we think of this as a side effect of mainly the levodopa. It's a symptom where you get extra movements superimposed on top of the normal voluntary movements. And so the person can appear as if they're restless or moving around excessively, or sometimes they can have muscle spasms as part of these movements.
But but if I take too much, I get wild. I don't know if you've ever seen, Michael Fox, how he moves, I get like that sometimes.
One other important thing to realize about the medications is that everybody has a different response to them. So Parkinson's disease is a very individualized disease in that everybody is affected differently by the disease. In the same way, everybody reacts differently to the medications.
I enjoy playing congas. I used to play it, before I got sick. When I take my medication, it makes it a lot easier. So it helps me a lot, And we sound pretty good, I think, because people stop to listen to us, so I guess we're playing, well,
I just would like to see him last, to spend time with his grandkids, to be able to walk his daughter down the aisle, to be able to see her be 16.
If they want a better quality of life than what they got right now, take your med, and enjoy life, because it's not the end of the world. That's my advice,